Hey everyone, thanks for checking in. Just driving home after my third family practice clinical skill session. Very excellent session. It was quite long, but it was just, time really flies when you're like really engaged, and it's just so awesome. It's crazy how much you can learn just through being exposed to what you're trying to learn and just apply it. And I love experiential learning. I'll probably harp on it a million times, and I probably harped on it already a million times. So you're probably sick of me talking about it, but today was kind of really cool because it was my first ever time actually measuring blood pressure. Not automatically, like that's easy to do, but actually manually. And it wasn't an epic disaster, but I got the systolic blood pressure right. That's kind of the higher number. The diastolic was a bit iffy, but it was good that I kind of knew what I was doing. And even though we had the vital signs seminar earlier, it was a great indication. There's still a ton of work I need to do really just to ingrain and hammer home these skills and really just getting comfortable. That's a really important skill, that kind of important message. Really do anything, but specifically in medicine, because it's so complicated and you're dealing with people. It's not like in the lab where you can be a little bit uncomfortable, but there's really not much on the line because it's private. So when I was working in C. elegans lab, using like a femtosecond laser to ablate neurons, if I messed up, well, I kind of look like an idiot in front of my supervisor, but he was super chill. Where like when I'm doing blood pressure, I look bad. When I'm looking out fumbling, not doing it correctly, I look bad not only in front of my preceptor, but also in front of the patient, and it doesn't really give them confidence that they're receiving the best quality of care, and that's really important. So you have to push yourself to put yourself in these positions where you may look a little bit stupid, you may fumble around, but you need to do it real time and learn how to be calm under pressure and just really master these skills to when it does become second nature, where it's just like riding a bike, right? Like when you first start riding a bike, it is scary as hell. Like you will fall down and hurt yourself, and you will feel embarrassed, but that's the process of learning, and you really got to relish and enjoy it. And just reflecting on my preceptor and my colleague just about our experience, and kind of I was mentioning to him, he was asking like, how am I doing? Because we're not only just writing the notes, but we're also doing the patient history and doing like a focus history. And then he's like, how do you think it's going? And I said, I'm a little bit worried about time. He's like, don't definitely worry about time at this point. Like, as long as you're not taking an hour and not actually getting to the medical issue, then don't worry about it. And then I mentioned that I felt kind of like I was missing a lot of key questions. He's like, that's why you're the student. If you knew all the right questions to ask, you'd be the doctor. And and a lot of it, that goes back to why the foundational knowledge is so important. And he made a great point that if you can relate your cases and kind of a face to it, instead of, oh, it's just this abstract problem, but hey, he mentioned that your first ever patient who had a certain thing, let's say it was due to a chest infection, you're going to really remember that. And it really takes looking at pneumonia and all the different types of like bacteria and like the most common types of community acquired pneumonia, in pneumonia. So whether it's streptococcus pneumonia or it's myoplasma pneumonia or etc., like that, you can get lost in detail, can seem overwhelming and kind of why the hell does that matter? But when you can relate to, hey, this matters in actual practice because of X, Y, Z, and I saw in this case, and it's like boom, and it really kind of gives you context and really motivates you to learn it. And yeah, so it really takes the abstract and makes it kind of real. And I think that was really cool. But then on top of that, he mentioned was like you need the foundation to ask the right questions, but you also have to be willing to push yourself to, again, be uncomfortable and ask those right questions and be clear. And he gave this really good analogy. You almost want to think like you're a lawyer, right? You have to make sure this thing stands up in court. So for example, if a patient says, I have a cough for a few weeks, what is a few weeks? Or if they say a couple of weeks, you can assume that because to you, couple means two, that it means two to the patient. And they may not know the Canadian thoracic guidelines that patients should have a chest x-ray if they're having a cough for more than 3 weeks, right? So it's really important to ask these really direct questions and ask them in different ways and make sure you're clear and not ambiguous with your questions. But you also have to be watching kind of the patient's body language, right? So if you ask a question, so for example, if they come in with a cough, They may think it's a lung issue, but you, because of your history, you may think to ask them about if they have reflux, gastro reflux, and they may look at you funny, and you would notice their body language, and you would pick up on it, and you would kind of give a brief explanation that sometimes the only symptom of gastro reflux will be coughing, because the acid will come up and cause irritation of the bronchi and the trachea. So that's a really important, you have to really be asking those questions. They may just say, no, I don't have it, right? Because they're like, in their mind, they don't think they're at all related, but that's part of how you're taking this knowledge of medicine, and really, you're not only helping treat the patient, but also better helping educate them, right? So so just really kind of wrap up from my main experience. The two main takeaways was, you really got to put, the initial process of learning can be quite uncomfortable. You got to push yourself and really get comfortable pushing your skills and learning more about the problems. And secondly, you really got to be willing to, again, push yourself, but to be more clear and really take notes and understand what's the thought process of doing questions. And really today hit home about, just because of the cases we had today, about how difficult diagnosing can be, right? And there's a common psychological kind of bias we have as humans, where we misattribute how difficult coming to a conclusion is. So for example, this is an issue that when people go from a RPN to a nurse practitioner, right? When you already know the diagnosis, then figuring out the treatment plan is easy. But figuring out what is the right diagnosis without knowing it already, that is really the difficult part. And I'm really seeing that in my family practice skills today, which is really awesome. And it can be definitely quite challenging, but it's really cool to see how the process kind of evolves based off the questions my preceptor is asking, and kind of when he explains his thought process. And it's definitely something that's going to take me not only my years in medical school, but obviously my residency, to really fine to it and understand how to best ask the questions and really get to the point, but also without making the patient feel uncomfortable, because you don't want to induce suffering or illness because of how you're asking questions. So that's why communication is key, and that's why it's so awesome. UBC really gives us the opportunity to not only practice doing patient interviews in kind of a non-clinical setting, but also to be thrown into the fire in the family practice and really learning to be comfortable with patients. Because as my preceptor said, if you're not comfortable in a room by yourself with the patients, then you're screwed. So thank you very much for watching this video. I hope you enjoyed it. If you did, please give it a big thumbs up, and make sure to share with your friends and subscribe to continue following my journey through medical school. Thank you.